Hello, I'm Danita Hester, and I'm going to show you the CareCompass patient list. If you're not in your train domain already, go ahead and open the train domain by clicking on your Cerner icon from the desktop. If you are a client nurse, you will need to enter your GR number and your password, and then we're going to redirect to that train domain website. In your address bar at the top, go ahead and double click between the word prod and web. Delete prod and type in the word train and hit enter on your keyboard. From the storefront page, verify that you are at the correct train domain page. The number underneath your icon should say T0276. I'm going to go ahead and click on Power Chart. Because I had previously logged in, it did fill in my username, so it will do that for you throughout the course of the day. Go ahead and type in your password and click OK. For those of you working inpatient at Great River Medical Center, other than OB, and for those of you working at the Client Center, you will be working off of what is called the CareCompass. The CareCompass is a type of patient list that guides you in organization, planning, and prioritizing the care of your patients or elders. CareCompass displays much of the information that you're going to need to provide care to your patients or elders. One of the first things that we need to do is establish a relationship with the individuals that we will be taking care of. To do this, you will note you have an Establish Relationships button. You will always have to establish a relationship with a patient or an elder the first time you are entering their chart. Click on Establish Relationships button. Note the yellow field. This is a required field. We also know it's required because it has an asterisk beside the word relationship. From the drop-down, select your role, identifying why you are accessing this individual's or all these individuals' charts. To establish a relationship with all patients or elders at one time, click the Select All button in the lower left corner of the box, and then in the lower right corner of the box, select Establish. Once you have established relationships with the people you will provide care to, you will see more information on your CareCompass. Before we proceed, I want to point out a couple things to you. You will see different icons throughout the charting. One key phrase to remember is hover to discover. Anywhere you see an icon, if you hover over that icon, it will pop up a little extra information about it. And we'll be able to do more of that here in just a little bit. My first column shows me the location of my patient or elder. The next column is my patient's name. I can see their age, their gender, allergies, and diet. When I hover over their name, you will see that more information pops up. The next column is why my patient or elder is admitted. Now I will note that the Client CareCompass may have a few different columns than what we see on the Great River Medical side. My patient has been here for 5 months and 3 weeks with a UTI. My patient's care team includes Dr. Volk. If additional providers or other team members were assigned to this patient, you would also see their names in this box. When I hover over, I get a pop-up that contains all the caregivers assigned to this patient. At Great River Medical Center, we will be identifying patients, family members who can call in and obtain information about their loved one. They will be identified by the patient, and we will enter those names on the admission form. Once we do that, they will show up in this patient password folder or column. The next column is the bedside mobility assessment tool. That is an assessment that we complete at the hospital side. Once we have completed that assessment, we will see here what transfer or ambulatory assistive devices the patient will need. The activities column provides us with information about the activities that need to be completed for our patient during our shift. As you can see on my patient, acute 3, there are 13 tasks that need to be completed and charted on. When I hover over the activities box, I get the secondary pop-up that says that I have 0 medications, I have 4 patient care items, 8 assessment items, and 1 other. If I want to look at what those items are, I can just click on them from that pop-up. So I'm going to click on patient care, and it will open an additional activity window. From this activity window, I can see the patient's name, their age, gender, date of birth, their MRN number, and their FIN number. These icons here represent the medication, the patient care activities, the assessments, and the other items. So right now, only our patient care button is highlighted. I can also look out through different time frames. I can look at 2 hours, 4 hours, or 12 hours. So currently I'm just looking at 2, but my shift is most likely a 12-hour shift. So I'm just going to go ahead and click on 12 hours. And then I can see all the activities that I need to complete for this patient over the next 12 hours. If I want to look at my medications that are coming due, I can look here, or my assessments, or any other items that I have ordered. To close this window, I can simply click this little white arrow beside their name, and it will hide that window. The next column that we have on the Great River Medical Center side is the quality measures column. CNAs will not see this column, but the nurses will. This indicates how we are progressing in the completion of quality measures. To review the quality measures that have triggered for this patient or elder, I can click on the quality measures button, and then I will see an incomplete and a complete. So it looks like I have not yet completed the immunization influenza quality measure for my patient, but it does look like the VTE prophylaxis quality measure has been completed. We will be addressing those in a different module. My last column is the plan of cares, or the power plans that are in a planned state for this patient. When I hover over 4 suggested plans, it shows me the care plans the system is recommending that we add based on the patient's admission. At the very bottom of my screen, I have an activity timeline. This activity timeline combines all tasks that are due to be completed on my shift for all my patients. As you can see, I have columns that indicate more activity during that time frame. So it looks like at 12 o'clock, I have a lot that I need to accomplish with this patient. What this does is helps me organize my day. I can identify the times that I'm going to be busier, and then I can work in the times that I need to perhaps do some patient education, or take my patient for a walk, or do a dressing change. I will be teaching you how to create your patient list in a live setting. At this time, go ahead and familiarize yourself with the Care Compass